And I realized that we do a tremendous disservice to our young children in not teaching them how to keep their teeth clean, because keeping their teeth clean will eliminate 95 to 99% of all bacterial damage. And that's what decay is. And that's what can shorten a lifespan by 1 to 2 decades. It's been studied extensively. People with uncontrolled dental disease in their mouth versus people that have clean, disease-free mouths live 1 to 2 decades longer. Well, that's not just, saving a little money. That's extending your health span. And the difference between lifespan and health span, lifespan is how long you live. Health span is how long you live healthy and functional. And you want lifespan and health span to be the same age and be way, way far out. You want that to be in your hundreds, and that's very doable nowadays. So back to the book, Teach Your Dog to Floss, a book for mothers and grandmothers to read to their children. And it's a way to explain how to teach this, and that dental disease is a communicable disease. You get it from your parents most of the time, or your grandparents, or your siblings. But you cannot be born with the bacteria that cause dental disease, both around the teeth and through the teeth, because it takes a non-replicating surface. What do I mean by that? I mean, if you're a little boy and you don't ever wash your elbow, it doesn't matter. The skin falls off, and any organisms on you fall off on a regular basis. But the teeth erupt into the mouth, and that surface doesn't change for the next 80 or 90 years. So that's why it's so critical, and that's why dentistry evolved as a subspecialty of medicine. We have the same medical training as the MDs. We don't have the clinical training in medicine, but we have the same medical training for 2 years. A lot of dental schools and medical schools have the classes together for the first 2 years, okay? Back to bacteria causing problems and learning how to control those problems. Mothers and grandmothers need to know it's communicable, number one. Number two, it comes from them. Number three, if they know how to clean their teeth properly, they can teach and evaluate their children and grandchildren. If they don't know how to clean their teeth properly, how do you child early reading skills if you can't read yourself, if you're illiterate? Well, 90% or higher of all parents and grandparents are not skilled enough to clean their own teeth properly, are not knowledgeable enough to be able to evaluate whether or not they're cleaning their teeth properly, or their children properly, or their grandchildren properly. So it's a very, very simple educational uh, that could eliminate, as I said, 90 to high 90% of all future dental disease, bacterial dental disease. Now, it doesn't stop injuries, and it doesn't stop a couple of things, but those are rounding errors compared to the bulk of dental disease that's caused by bacteria and diet primarily. So, um, to the back to the message of the book is parents have to understand that they probably need all the bacteria in their mouth cleaned out. They need to learn how to clean their own teeth, and these are simple things. And so in the book, after the picture on the cover of my chocolate lab flossing his teeth with green floss is a picture of the patient who showed me her brushing her dog's teeth. And that's what triggered this entire discourse about teach your dog to floss. So teach your dog to floss. You can't teach a dog to floss silly. And then going through the in a children's book version of explaining this to children. And then the second half of the book would be for mothers and grandmothers um, teach them how to do it, how to evaluate it after it's done. And one of the simple things, we actually punish children with brushing their teeth. Adults get to stay up, brush your teeth and go to bed. That's punishment. If it was phrased differently, like, if you behave, get ready for bed without a fuss, we'll brush our teeth and read a book together. And then it becomes bonding time. And when I talk to my patient about her brushing her dog's teeth, and she told me, well, you just have to start when they're puppies. And then she threw in something that really caught my attention. She said, if you don't brush their teeth every day, they pout all day long because they consider that bonding time with their owner. And just like early reading skills gives children a head start in education, brushing skills gives a bond with the parents. And it's real simple. You get a little stool, a little toothbrush, and you get a big toothbrush. And this doesn't have to be, as a matter of fact, it's better if it's not with toothpaste, which stops most children from brushing well. But you get a dry toothbrush and a dry toothbrush, a little one. They stand up on this stool, you brush your teeth, they brush their teeth, and then they take your toothbrush and check your teeth, and then you take their toothbrush and check their teeth. So you haven't cross-contaminated here, and in a year or two, that child will brush and control the bacteria on and around their teeth better than 99% of the world's population, and they will save on average somewhere between $25,000 and $180,000 in dental expenses. Not to mention all the time in the dental office, not to mention um, discomfort or anxiety caused by having to go to the dentist. So so it's really an overused word, game-changing, paradigm shifting approach to dental health, which is systemic health. You cannot disconnect oral health from systemic health, and you cannot disconnect systemic health from oral health. Like saying your hand and your fingernails don't have anything to do with the rest of your body. Well, they're obviously connected. They're part of one live organic system. So teach your dog to floss. It's to educate parents, especially mothers and grandmothers. They have the most influence in the whole world. I Now after 50 years, I realize I work for a general. She's really good, and everybody who's is a little chauvinistic. All successful males have a very successful female behind them.